Did you know that in 2025, Kenya recorded over 20,000 new HIV infections? And of these new infections, over 13,000 were female and over 6,000 they were males. Today, over 1.37 million Kenyans are living with HIV. It's time that each and every one of us played a role in helping reduce the HIV infections. As much as we had over 20,000 new HIV infections, we also had a cut in like 80% of new infections. So that's a positive. But now what worries most is that most of these new infections, they came from mother to child. Like infection wakati zilipatikana, mingi zilikuwa zinatoka kwa mama hadi watoto. In this video, we are going to talk about transmission of HIV. So first, I will deal with the misconceptions, and you have to know that HIV is not transmitted through things like hugging, to shake hands with infected persons. Also, sharing utensils, toilets, or swimming in the same swimming pool with infected people won't transmit the virus. Then we also have animal bites. You won't be infected when you're bitten with a mosquito that has bitten someone with HIV. Also, touching or sitting close to a person who is infected with HIV won't make you get infected with the virus. And now these are the cases that will expose someone to the virus when having unprotected sexual intercourse. About this, are people having anal sex, they are highly likely to contact the virus in case one of them is infected. So during the breaking of virginity, someone will be highly exposed to cases of HIV transmission. We have mother to child transmission. This is either during birth, pregnancy, or during breastfeeding. We have sharing of needles and piercing items, and also surgical items. People may contact the virus when they are sharing needles or piercing items such as the surgical blades and etc. This one may expose somebody who is not infected in case they are sharing the tools with somebody who is infected. Also sharing personal items such as the toothbrush. We have blood transfusion, but this one is very rare in Kenya because before any transfusion occurs, the blood has to be properly screened. We have accidental needle injuries. This is to healthcare providers. Some may be exposed to the virus from the patient when they have, for example, you inject yourself accidentally. Then lastly, make sure when you're handling accident victims, more so when there is blood spillage, make sure you wear protective clothing. Do not touch people's blood in accidents without gloves and protective clothing. Okay, so in case I've forgotten anything, just drop it in the comments, and also make sure you educate somebody about the transmission of HIV. So we are going to talk about the prevention. So the first one is use condoms correctly and consistently. We have the male condoms and the female condoms. This will protect you from contacting body fluids. Get tested regularly with your partner. Nowadays, we have the self-test kits that you can buy from a chemist near you. Make sure you buy a kit and you get tested, you with your partner. When you are pregnant, make sure you attend the antenatal clinics and do HIV testing. And also you practice the PMTCT care. Avoid sharing of sharp objects such as the tattooing, piercing, needles. This will expose you to the virus in case the other person whom you are sharing the objects with is infected. Then you can take pre-exposure prophylaxis in case you're going to have contact with somebody who has the virus, and also you can take post-exposure prophylaxis not more than 72 hours after having contact with somebody if you are at a high risk. Support people living with HIV because in HIV, stigma kills faster than the virus itself. Show love to people living with HIV, AIDS, because HIV is not transmitted through air. It's a disease that has to be body fluids in contact. Okay, so also make sure you show love to people living with HIV. You support them. In case they have no food, you provide for them. Be their comfort. Just in short, be their comfort, and these people will have a healthy life and also a proper state of mind for them to fight the virus. In case you have other methods that you think may help protect, then you can make sure you leave a comment